Hi, everyone. Welcome and thank you for attending this month's webinar presented by Dr. Joe Allen on healthy buildings as a public health tool. My name is Nicole Tulvey, and I am chair of the membership committee for the International Society for Exposure Science, and I will be moderating this webinar. For those of you who are not society members, please consider joining the society as we have many benefits, including exclusive access to a recording of this webinar after the live session. A few quick housekeeping notes before we get started. In the upper right-hand side of your computer screen, you will see the control panel. Please note that the webinar is in listen-only mode. Throughout the presentation, you can type a question or a comment in either the question box or the chat box, and we will review them at the end of the session. And we will hold Q&A until the very end of the presentation. So as I mentioned earlier, today's speaker is Dr. Joe Allen. Dr. Allen is an assistant professor at the Harvard School of Public Health, and he's the co-author of many documents. He has a great portfolio, and he wanted me to keep the introduction brief. So with that, I'm going to turn it over to Joe. So Joe, the floor is yours.
That's great. Thanks, Nicole. Perfect. Hi, everybody. It's really great to be invited to join you today and talk a little bit about healthy buildings in the context of COVID-19 and then thinking beyond COVID-19 too. And also about the role of exposure science in this quite unprecedented moment we find ourselves in. And so, my full academic title is Assistant Professor of Exposure Assessment Science. So normally I have to explain what that is, but it's really nice to be here with you in ISES, and I don't have to explain what exposure science is. So we're starting from a good vantage point here. We're ahead of the game. I think I just want to share one thing about my background because it's really relevant to what's happening right now with COVID-19. So, we're all exposure science, or many in this field are exposure and risk scientists. I do work with our NIOSH-funded Education and Research Center for Worker Health and Safety. I'm a certified industrial hygienist. And all of these skills of exposure, risk science, industrial hygiene are all coming to play right now and coming to the fore as we think about the strategies we have to put in place to keep people safe through all of these different situations and we're finding ourselves in. How do we get back to work? How do we get back to life? How do we get back to, how do we go out to a park? How do we get groceries? And hundreds of the questions that I know you're all getting every day too. Prior to joining Harvard, and I still do this on the side now, I do forensic investigations of sick buildings. I've done this for a long time. And it's through that work, investigating, resolving cancer clusters or infectious disease outbreaks in hospitals, even, sometimes where people had died in the building and everyone was at risk, and we have a low information environment, and we have to make the best decisions we can based on the best available evidence. And so we've done that. I've done a lot of it, and it's for that reason that while the pandemic is really unfamiliar to us all, there's a lot of elements that feel quite familiar in terms of taking the science, the best available science we have, and translating that, and also putting it into practice to keep people safe. And in a lot of ways, it does feel familiar, oddly enough. Okay, so let's see if I can advance here. Bear with me a second. Okay, great. Yeah, I wanted to start with this quote from Elaine. It's actually when she first took over at Jesse as the editor-in-chief of Jesse, and I really like it. It applies right now, and I'm certain she didn't predict we'd be in this moment either, this exact moment. Sorry about this. Science matters, and how we do it really matters. And while we do feel maybe a longing for going back to January in some ways. January 2020 is gone. And the only way through this is through it and to shape a better January 2021 and January 2022. So January 2020 is behind us. And we just need to forge a better path forward here. And we all have a role to play in that. I want to acknowledge and thank all the great people on the Healthy Buildings team at the Harvard School of Public Health, terrific colleagues, doctoral students, postdoctoral researchers, professional scientists. In summer, we have a great summer intern cast this year too. So really, I think as we all know, it's all about the team and it's all about the collaborators you work with. Everything is about that. So I'm really grateful for these terrific colleagues. Each and every day we have a daily meeting, and it's the bright spot part of my day every morning. All right, I thought I'd start big picture, right? I think we have to talk about these kind of mega changes shaping our world. So we have this book. It came out last month. Wrote it with professor at Harvard Business School, John Macomber, and we decided to start it with these mega changes shaping our world, and it's quite relevant to what's happening now. But big picture, I think, of these first couple, which is we have a planet that's moving quickly to 9 billion people, and for the first time in history, more of us are living in cities than do not. And these are massive forces that are colliding and placing great strains on our natural environment, and in terms of resource usage, and also strains that we're seeing in terms of this changing climate. But I am optimistic that there are these other changes that are happening that are forces for good that are going to help us through this. And I won't go through all of these. Of course, we're going to talk about number 7, buildings today. Number 8, changing work. We're all seeing the nature of work changing right before our eyes. But number 10 is really quite interesting, because we had been talking about changing values when we first started writing this book 2 years ago, and over the past 2 years we were writing about that. And it certainly does feel like quite a moment of changing values for a lot of reasons. And so this is what at least gives me hope and makes me optimistic, despite all the challenges we're facing in society with this pandemic, with other slow roll crises happening, political inaction. I am hopeful on number 10 there that changing values is what will get us through this. All right, I really wanted to talk about, not really wanted to talk about, I also want to talk about buildings as a public health tool. I've been writing about this going back to early February. The first piece I wrote targeted for the international community in particular, it was in Financial Times, saying buildings should be our first line of defense against this novel coronavirus. But of course, this isn't anything new for our field or our industry. And we've known for a long time that buildings either promote health or they can spread disease. And I love this quote from Florence Nightingale going back, fresh open air is the only defense either a true nurse either asks or needs. And it's really a time to get back to the basics in how we're fighting this virus and everything else. And I love that we're drawing on all this, the basics of public health again, hand washing, and here the basics of bringing in more fresh outdoor air to help dilute indoor contaminants. I also want to bring in Alice Hamilton. So she was Harvard's first female professor. And I love this quote from her book, that she discovered first, or was the first to recognize, that these men in this facility were being poisoned by poisoned air. And at the time, that was not believed to be the case. They all thought it was through the lack of hand washing or touching contaminated surfaces and hand and mouth activity. And it's another call to get back to these basics that we've known for a long time, that higher ventilation rates provide a lot of benefits for chemical exposures to metals in industrial sites, but also for infectious disease. And we've lost our way over the years. And it can be tied to really the 1970s and the energy crisis, where the global energy crisis, which spurred this movement to tighten up our building envelopes, choking off the air supply, literally. And now we're in this era of sick buildings due to, well, many things, but a key driver is lower ventilation rates. So we've lost our way over the years. And I'm hopeful that coming out of this, as we think about the post-COVID world, that we'll get back to the basics of healthy buildings, things we've known for a long time, thanks to these great scientists. And I am quite humbled, and I recognize this, and I feel it's a big responsibility that somehow, some way, I ended up in Alice Hamilton's lineage at Harvard through this Education and Research Center for Worker Health and Safety. And so I find it it's something I reflect on a lot. I take it on as a big responsibility to continue that tradition. Okay. And so we've all, I think, in our field, in exposure science, public health, have recognized the potential for pandemics. And we didn't know this was going to be the one. We didn't know it was going to be a coronavirus. We didn't know it was going to be this year, but certainly we knew it was coming, and we had many early signs and signals. Other coronaviruses, SARS-CoV-1, MERS, influenza, H5N1, H1N1, and we narrowly escaped those, and this one hit us. And I point out that, this is an editorial that Michael Waring and I wrote in Jesse in early December, talking about the power of healthy buildings to advance health for all, where we call out the potential for pandemics and the role buildings would play. All right, when we think about buildings, been thinking about how we're responding to this pandemic, really, I think, at least for me, in three phases. And we're certainly, I think, still in the response recovery phase, but hopefully moving eventually to a resiliency phase. And so I'll talk about our initial response in making sure we're leveraging healthy buildings as a tool in our arsenal. And my concern is that this is not happening widely enough still. But I told you we wrote in early February in the Financial Times, rewrote again the New York Times here as the virus was spreading to the US, calling for these basics in building operation to mitigate the spread. And here's the way I think about it, and it always goes back to the science, right? We know that 3 modes of transmission are happening, despite one being highly debated at the moment. But the evidence is quite clear. We'll talk about the 3 modes because then that helps us determine which control strategies make sense, right? So if you think about large droplet transmission, then we know the controls: maintain 6 feet, minimum physical distancing, if not more, wear a mask. 2, fomite or contaminated surfaces. Here the control strategy is wash your hands, clean and disinfect surfaces. And 3 is airborne transmission. Airborne transmission is definitely happening. I don't quite understand the reluctance of CDC and WHO to recognize this. And the control strategy there in buildings, amongst others, is to bring in more fresh outdoor air, use higher filtration and recirculated air, deploy additional cleaning technologies as necessary. One of the things actually I'll leave it for question and answer. If you want to talk about airborne transmission, we can talk a lot about that. I'm working with a lot of people in our field and beyond, and on that evidence there. And each new piece of evidence further supports the strong likelihood that airborne transmission is happening. And I guess the thing that gets me a little bit from an exposure science standpoint is this. Let's say our field, or those in our field who believe this, are wrong on airborne transmission. It's not happening. What's the downside here? We bring in a little more air in our buildings. If we're right, and people aren't acting and trying to use these control strategies in a building, well, that's a massive problem. In fact, I wrote an article in the Washington Post, maybe it was last week or 2 weeks ago, linking airborne transmission and super spreading events. And the science there is building as well. And it's not something to be feared or cause anxiety, but we have to recognize the hazard to apply the appropriate control. This is the basics of our field. Okay. I want to talk about what we think about recovery and where what's next maybe. And here, I wanted to bring an article that I was fortunate enough to be invited to participate in this with Nicole, John, and Paul for Jesse, where we talked about this moment for exposure science. This is a moment for all of us in this field. And sure, the epidemiologists have been getting a lot of attention, and that's good and that's deserved. But the reality is, right, epidemiology has a role to play. I think we need that to understand disease dynamics, certainly. But I really think it's a moment for exposure science, and I don't see enough of us out there, not to our fault of our own, but I think, well, maybe we do have to do a better job of making our voice heard. But it's really becoming the point where exposure science and risk science are absolutely critical as people start to make these really life and death decisions about when to reopen, how to reopen, what controls to put in place, when should schools be open, is it okay to have gatherings of 10 people, less than 10 people, do you put in plexiglass barriers, what do you do in a lobby, what do you do in an elevator, right? There's a million and one questions, and I think our field is the field that is really well positioned to help answer this. And in this short editorial we wrote, there's a couple things that I wanted to highlight that I think are quite relevant. We can contribute in many different ways. One, it's central to our field to identify the most vulnerable populations and then act strategically to protect those who are being disproportionately impacted. And the data there are stark. We see major outbreaks in senior homes, accounting for over 40%, maybe higher, of deaths in Massachusetts, where I am. Industrial facilities like meat processing plants. We see communities of color have 10 times more likely, or 5 times more likely to die from COVID-19. Low-income communities in one study, 10 times more likely to get infected. And so, this is what we do in exposure science. We're always talking about the most susceptible, the most vulnerable, and what controls need to be put in place to protect them. So we need to do a better job there, and that's a collective we, not just our field. We also talk about exposure science and the role of examining co-exposures, right? Nothing exists in isolation. I think of the great work led by Francesca Domenici and others linking out higher risk from COVID-19 and outdoor air pollution. We also have a role to play in communication and research translation and training, right? If you put out an intervention measure without training, it's going to fail. We know this. This is also central to our field. I think a great example of that is the difference between how the hand washing intervention was rolled out versus mask wearing. Now think about hand washing, right? We didn't tell people go wash your hands more frequently. It got rolled out with great video and explainers, and now everyone is singing happy birthday when they wash their hands. We all know how to wash our thumbs and our fingertips, right? We're all experts in hand washing now. That's effective. Contrast that with mask wearing. Well, wear a mask. I wrote an article in Washington Post. The debate is over. We should be wearing masks. But that rollout didn't come with any leadership. In fact, the leadership in some places failed to acknowledge that this was even in fact a control strategy that should be used. You can do it if you want. We didn't give information on how people should wear a mask or what types of masks. It was just recently that WHO released information last week on mask wearing and the types of masks. So that was already several months after the public health community was calling for mask wearing. So we need to do a better job there. And there's something in our article here that I'll read just quickly. And I think John might have written this part, but I really like it. As scientists, we talk like scientists, and that's good and that's important. But right now, at least when we're communicating the science, John, in this article, people do not need to hear about the 95% confidence interval for viral exposure dropping by a given percentage as a function of distance. They need to be told to stay 6 feet apart. I think that's right. Is that there's a danger here in overcomplicating it. Not that we don't want all the nuance and the detail, but when effective public health messaging sticks, we should need to support that and add nuance later. Another thing we talk about in this article is the need to go back to our tried and true tools. And here we brought in the use of the hierarchy of controls, something that is well known in the field of worker health and safety, as a prioritization framework for what controls should be put in and when, and what should go first and what should go second and down the line. And all we did here was add in what this might look like as applied to SARS-CoV-2. We have some examples here on the right, and I'll reframe this a little bit and think about return to work strategies. So you might think about eliminating the hazard. Well, that would be staying home from work, prioritizing work from home. Not everyone can do that. And so we have to move to these other control strategies. If you can stay home, that's best. Substitute the hazard is, who are the core people that would have to go back, who need to be physically present in the building, or essential workers. Then engineering controls. These are healthy building strategies, right? This is where we have to put in higher ventilation rate, better filtration, and think about these enhanced cleaning, disinfection, and really make the building work for us. Then we get into administrative controls. I think of this largely as de-densification strategies. So how do you manage occupant density, flows of people, choreographing people through the lobby, through the elevator, maintaining or keeping the floor plan and such that people don't have to be within 6 feet of each other. And then last is PPE, or personal protective equipment. And definitely I'm a proponent of mask wearing, universal mask wearing. And certainly there's some environments like an elevator where we're going to have to use masks. There's no other way through it. The other controls don't quite work. Okay. One of the things I want to talk about next is a little bit of maybe what I'm seeing is a gap right now. And this is an article I wrote it was last week, maybe two weeks ago, with John Macomber at the Harvard Business School, talking about the next phase of this. So many companies now have their plans for how they're going to repopulate their buildings. Universities are getting there. But the next question is, who guarantees, or how do you know the controls are working? And I hear fewer people talking about that. And in this article, we give a strategy for how you might start to thinking about that, is verifying the controls are working. Again, this is something that maybe it's preaching to the choir a little bit here, and that this is central to our field, right? We don't just put in a control and walk away. You put in a control and you monitor that and verify the performance of that. But I see few organizations focusing on this aspect now, and they need to be. And one of the things I've been talking about and writing about for a while now is the use of health performance indicators. So there's a lot on this screen. I'm not going to go in detail, but I'll orient you to it. But let's start big picture. Maybe really big picture here, which is thinking about a truism in business. You manage what you measure, right? And so if we're measuring the wrong things, we're not going to manage it. And so companies track KPIs all the time. So if you're not familiar with that, that's key performance indicators, really familiar in the business world to use that language. Well, we want them to start using HPIs for health performance indicators. So they're explicit about what they're trying to do in these buildings and not just for COVID-19. All right, so we broke this up into 4 quadrants, really. We have these direct indicators on the top half. These are things that are about the people. The bottom, I see that as about the building. And we have these lagging indicators and leading indicators. And so we could think about that top left quadrant as things that are about the people but lagging. You could track illness trends and sick days, but this is after the fact. If you go down to the bottom left, you could track things after the fact that are about the building. The top right quadrant is really quite interesting. I don't think many organizations are there, but we are moving towards that, is how do you track people in real time to like sentiment analysis or digital phenotyping, like my colleague Jay Pionella at Harvard School of Public Health has coined. But the bottom right is the one I love, because this is everything you can do that's related to the building that is a leading indicator of performance. And the central premise of what we write about in this book is that building performance drives human performance, drives business performance. So if you get this bottom corner right, if you're designing your building right, if you're thinking about these healthy building strategies, maybe even pursuing certifications, being smart about the materials you select so we don't build these beautiful, shiny new buildings and then pollute them on the inside by making bad choices in terms of the products we're going to put in this space. Are you using principles of biophilic design to bring nature indoors? If you're doing all of that, we know it's going to have a benefit to human health, and we know, and we make the case in this book with hard data, that this leads to business benefits. So this isn't a business seminar, but I think we'd be foolish not to link our science all the way to the business case, because ultimately these are the people who are going to be making decisions with our science, and it just adds to that decision matrix if we can make the business case. Last thing I want to point out is that box at the bottom, the circle in the bottom there, that rectangle, not quite a circle, is taking the pulse of the building. So who is responsible for ensuring the health of people when they put these plans in place? Well, the only way to know it, that your plans are working, is to take the pulse of the building. We call it the pulse. think about when you go to the doctor's office, what's the first thing they do? You take your pulse, they take your blood pressure, these indicators of human physiological performance. Well, we argue that we should be taking the pulse of buildings with these real-time measures, like CO2 as a proxy for ventilation, temperature, RH, of course, acoustics, but also some of the more traditional industrial hygiene measures like water quality, things we can't measure in real time just yet. But it's absolutely critical to be taking the pulse of the building now during COVID, but also in a post-COVID world. All right, I want to move on to this phase, thinking about, well, where are we going and how are we going to get there? So in the book, we talk about this idea that employees are interviewing your building. And I think companies are really surprised to hear about that. Maybe you've heard of Glassdoor, where employees go to talk about their salary, their boss, their culture, their job title, and things like that. I think most people are really surprised to know that employees are also talking about their building. And there are many examples, right to the basics. It smells in this office. It's too hot or too cold. I can't concentrate. But I pulled up two examples here that are actual quotes that are on Glassdoor right now, where people are talking about their building and their company in the context of COVID. And one is good and one is bad. One says, how is this different than being on a virus-infected cruise ship? The other person, well, I couldn't be happier. Different companies. Health and safety is foremost, utmost importance to this company. This kind of information is not exposure science information. It's not hard data from a sensor, but it's data, and this information is going to live and be tied to these companies forever, so much so that the next person coming to work at this organization will have this, and it will factor into their decision. Which company are you going to go to, all else equal? And so I think companies are really surprised to see this kind of data about their organizations that are populating. It's not far-fetched, in fact, it's happening, to realize that this kind of qualitative data will be paired with quantitative data with the proliferation of real-time sensors, good and bad, that people then post and share with regard to how the indoor space or their business is performing. That will also be part of future employees' decision matrix. We've been using at Harvard this idea of the 9 foundations of a healthy building, which is really derived from 40 years of all of your science. Let's start bigger picture. The goal here was to simplify the science for the business community after I recognized that, having talked to a lot of these executives, that much of the great science in journals like JESSE, in journals like Indoor Air, in journals like EHP, was not penetrating the market. It was totally inaccessible to them. And so our effort here was to create this 9 foundations to say, it's not that hard to create a healthy building. It really isn't. It's the truth. It's not that hard. And there's all this great science that's been sitting on the sidelines a bit. And so you can leverage that and just focus on a couple things, and you can make your indoor environment a bit healthier, make your employees healthier, and at the same time, do well for your business. I'm going to wrap up with 2 slides before we get into question and answer, but I've been talking a lot about buildings, but I want to put this in a bigger context. This is a project I launched with colleagues, epidemiologists in Harvard Center for Communicable Disease Dynamics. And by the way, they've been doing a fabulous job on communicating and putting out the models. If you're not following the folks in this group, I highly recommend it. They're really terrific. And we put out this website, covidpathforward.com, where we outline the science on 14 priority areas to save lives and the economy. And we've been adding new science and new reports as they become available in each of these priority areas as a way to really help the public and also help influence key decision makers that there is a way through this. And objectively, at least in the US, we are failing miserably here. We blew it starting in January. We bought ourselves time starting in March at great economic cost and cost to lives. And we find ourselves in June, and still we have not put in the testing and tracing we need. On other fronts, I think we're doing okay. But if you're interested, you can follow along here and help promote or help add content around these priority areas as we track our progress towards managing this, which of course goes way beyond exposure science and our field. Okay, very last, I wanted to bring in something from a friend of mine, my now neighbor, Joe Jones, but Joe and I have circled each other for most of our life, it turns out. I'm a basketball player. I used to, back in high school I played, and it turns out Coach Joe Jones coached against me. And when I used to go to basketball camps at Villanova, he was there coaching me. And it turns out we ended up being neighbors. So we've been around each other our whole lives. He was in New York at the same time I was. He was at Hofstra when my sister was there. Anyway, we've kind of danced around each other for a long time. And I wanted to bring him in here because he had a long interview in the Boston Globe this week, and his words really resonated with me. And maybe they resonated because I guess I realized that, you know, it's a funny thing when I'm 44 now to think that I'm still being coached. And but I am, and I have a lot of learning to still do. And but I really like his words here, talking about humanity and fairness and the things we learn when we're growing up, the things we're supposed to learn when we're very young and in kindergarten, and we've lost that, and we're losing it, and it's not the way it's supposed to be. So I was very moved by his words. He's very passionate guy and a great friend. So I wanted to share his words here, and also encourage you to read that whole article. If you just look up Joe Jones and Boston Globe, he says a lot there that is really worth listening to, and I appreciate it. All right, so thank you for inviting me to present and talk. I tried to end, with plenty of time for question and answer. Happy to talk about any or all of this, and see where you want to go. Thanks.
Hey, thanks, Dr. Allen. Great presentation. All right, we'll give people a chance to put their questions in their question box, and we'll go through them. Well, there's several here. Okay, let's see. So the first question is, will the current ASH RAE recommendations, it's just an acronym, hopefully you're familiar with that, be sufficient? That's the first question. And then there's a follow-up of how do we document efficacy of ventilation?
Yeah, so ASHRAE's put out some good guidance, I think, on how to handle your HVAC system. I think I'm glad they did it. I think because a lot of people are asking these questions. For many people, it's their first introduction to public health, and maybe it's their first time they're thinking about their mechanical system. And so that was needed, and that's the right organization to put that out there. I do think, you know, I've been publicly down on ASHRAE for a long time in terms of their standard for acceptable indoor air quality, the ventilation for acceptable indoor air quality. It's an acceptable is the problem. It's a minimum standard. Most buildings are designed to this, but it's not a performance-based standard. I think the science is really clear that higher ventilation rates than what is specified in ASHRAE 62.1 provide many, many benefits. And ASHRAE itself hasn't been fully clear over the past 40 years of whether it's trying to be an energy-based standard or a health-based standard. That's a problem. I know they agree on it now, but just the fact that they haven't been in agreement for a long time tells you something about that standard. And so I would encourage ASHRAE and all of us to encourage ASHRAE to start thinking about a health-based standard, a real health-based standard, not an acceptable ventilation standard, a health-based standard. Because the problem is the market hears the standard and they put it in without recognizing the nuance. And ASHRAE is really clear. Hey, this is the minimum standard. But the market hears this is the standard, not minimum. And the reality is almost every time I've done one of these sick building investigations, and in fact, even in good buildings, you'll find that they're rarely even meeting these minimum standards. Take schools, for example. Look at the work by Rich Corsi over many decades showing schools are chronically underventilated. Rich and many others, chronically underventilated because we design them and we forget about them. So that's a big problem that needs to change. I'm even working with a lot of organizations right now in their return to work strategies, asking them, first thing, take an inventory of your systems and what they can and cannot handle and what they're doing. I have to tell you, in the past 2 weeks, 2 excellent organizations with top-notch facilities teams came back to me and told me things that would shock you in terms of the performance of their ventilation system. Things like, we didn't even realize the ventilation of the bathroom was off. They didn't even know it. It falls just low on their facilities maintenance priority. These are really good organizations. So what's happening in the average building? we know it's not good. I've seen it many times. So to the second point is, well, what do we do about it? Yeah, so first we should commission our buildings. Absolutely. We should have continuous commissioning of our air handling systems. We should be recommissioning them before we move into buildings that we've had a period of low occupancy, including our water systems. And we should be monitoring in real time indicators of ventilation performance, like using CO2 as a proxy for ventilation rate. I don't think this is all that hard. I think some organizations are doing it. What I think is that the organizations that don't realize the importance of it, and that's incumbent upon us to communicate the importance of the science and why this matters to human health. So then they have a reason to do it. And we have that opportunity right now because for the first time, the entire world is aware that the built environment and buildings and time spent indoors has a massive impact on our health. So if there was ever a time to kick open the door in an organization to say, hey, buildings matter, it's right now.
Great, thank you. So the next question is sort of long. It says, traditionally, buildings were moving towards less outdoor air, more recirculated air as energy efficiency came to the forefront. Can you discuss the implications for the progress made on making buildings more energy efficient and how the push towards changes in ventilation you suggested are going to affect that energy efficiency?
Yeah, this is what I was talking about earlier about losing our way in the 70s in response to that energy crisis, right? We've been building buildings and focusing our effort in buildings entirely on energy. And I'm not discounting the importance of energy in the climate conversation, right? I understand this space. But the point, I guess, a couple points here is that one, it's a false choice, energy or health. We've been given a false choice. It's a false dichotomy. We're saying, well, we have to do this. We've got to close the dampers down. We've got to save energy. We can actually put in energy efficient technologies that can deliver high ventilation rates while at the same time conserving energy. If we just commission existing buildings, we can save energy. Look at the work at a Lawrence Berkeley National Lab on the energy savings that can be had if we just commission existing systems. So just take the existing systems and just do them a little bit better. I don't think we can disentangle this conversation about buildings and ventilation and energy from the larger conversations that need to be had in terms of our energy system. If we have a clean energy grid, I don't really care how much energy you use in a building. So this idea that, it's just on the consumer side, or we have to make people sick in buildings to save energy, so we don't pay attention to the real priority, which is cleaning up our energy grid, getting off of fossil fuels as the primary source of energy in our buildings, including on-site combustion of fossil fuels. So we have to approach this holistically. I think it's been simplified over the years and been presented as that false choice of energy or health. That's not the case.
Thank you. So this is a question pertaining to landlords and property managers. It says many businesses rent their space. Have you discussed the role that landlords and/or property managers may play in maintaining building health to slow virus spread?
Yeah, so it's a great question. And I've been talking a lot about this with the organizations I'm advising, and that's schools, universities, it's homeless shelters, it's courts, it's prisons, it's commercial real estate, finance sector, theaters, the arts, and everyone is facing that same issue. But here's the reality. The only way through this is if everyone does their part, right? Once groups start butting heads, it's going to fall apart and the risk will increase. The building owner has an important role to play in terms of the systems in the building, how you're going to manage flows of people, are you going to do screening out front, how you're going to handle the elevator, codes of conduct for the building. The tenant organizations of that building have a role to play too. One, they have to be sure that their strategies are aligned with the building. One can't be more stringent than the other. There has to be coordination in terms of staggering or lengthening the workday, staggering arrivals, making sure the tenant organization that has a longer workday has matched up with the building mechanical system functioning to be sure that the mechanical system is operating to match the tenant strategy. But there's a third part here. It's the building, it's the tenant, but it's also the employee. We all have a role to play here. All right, if we're going to go back into offices and retail and shops, well, we're going to have to take personal responsibility and it's personal behavior change. We're going to have to wear a mask. We're going to have to stay home if we're not feeling well. We're going to have to stay home and self-quarantine if we've been in an environment that puts us at a higher risk, so we don't transmit during this pre-symptomatic period. We're also going to have to, give people their space, be willing to follow the rules. We also are going to have to go in with a lot of patience. because it's going to be frustrating in those early days as buildings and systems and companies figure out their processes. It won't be smooth in the beginning. It's going to be frustrating in a big building waiting for that elevator the first time. It is. It reminds me a little of the post 9/11 period in airports, where if anybody traveled in that period, it was really rough for a couple of months. But eventually the airports figured out systems to make it a bit more efficient and got the flows of people down. So anyway, long way to say, you know, everyone's got a role to play. And the key here is they have to be synced up. Otherwise, if they're at odds or at differences, it's going to fail. It won't work.
Okay, great. So this question has to do with HVAC systems and temperature. Is there an ideal setting?
Yeah, it's a good question. I haven't looked into that as actually looked into it, but not ready to comment on you know, what an ideal temperature is for this virus specifically. I think we're learning a lot about this virus. I think this is wrapped up in questions of relative humidity as well, which we understand a bit better, or I'd say much better for viruses in general, but less so with this virus in particular. So you know, the strategies, the prioritization I like, and ASHRAE does this, and actually hospitals do this too, is can you prioritize bringing in 100% outdoor air? If not, and you're recirculating that air, you have to put in higher levels of filtration. Can you supplement that with things like portable air purifiers as first and foremost, are higher prioritization schemes to minimize risk, again, but just for the airborne route of transmission. We still have to do those other controls for large droplet or close contact and fomites or contaminated surfaces.
Great, thank you. Does the coronavirus transmit easier in a low humidity or a high humidity indoor environment?
Yeah, it's a great question. And I guess a lot's wrapped up in that, because it talks about transmission. And, you know, we know about humidity and host susceptibility too. So I partially answered that with my last comment that we know a lot about viruses, other viruses, and maybe an ideal, or let's say a preferred relative humidity range of 40 to 60% for indoor environments, which is good for both the receptor, the person, but also mechanistically provides some benefits in terms of the virus and the droplet and how long it might stay airborne, and other chemical reactions within the droplet. So a lot is happening there. I'm less ready to make a definitive statement for this virus. And the other thing I think is really important here is that, you know, at least my approach has been really intentional in making recommendations that nearly every building can do right now. Because I see what's going on in the market sometimes where, you know, people are talking about certain air cleaning technologies or upper room UV, and that's great, and it can work, but that's going to take months to put in, and is a massive expense. So if you are a hair salon, I shouldn't be talking about hair salons. I have no business talking about hair salons. But if you're a retail place or a place, all right, you know, can you actually put in some of these newer technologies or control humidity with your existing systems? It's unlikely. So I think that's part of a bigger conversation, I'd say, about, let's say, the future of HVAC system design and operation, and thinking about thermal controls, disentangling thermal from ventilation, thinking about humidity control. But in the here and now, for what people need to do, I think we need to give guidance that is actionable right now in the vast majority of buildings. And the vast majority of buildings, even if we told them, wow, 40 to 60% relative humidity is the target, how many can actually do that? I think it's a small subset right now.
Yeah, thank you. So this next question, I serve on a response team, and I have been relaying the science of this as you did today. But there seems to be a disconnect with the education of the public and the politics of I'm a free American and cannot be told what to do to be healthy. Do you have any suggestions for how to bridge this gap?
Yeah, it's challenging. Unfortunately, some of the science has become politicized, and masks, I think, is a good example of that, unfortunately. I think our role as scientists is to stay as apolitical as possible, right? We all have politics and opinions. I've been trying really hard to stay apolitical so I don't lose audiences. And my feeling is this: if we lead with the science, and stay true to the science, then when people hear that, they will act in their accordingly, because people want to stay healthy, right? The problem where they don't believe is they don't believe the science, they don't believe the messenger, maybe they don't believe the media or how it's portrayed. But if they do, if we're good with the messaging on the science that says, here's how the virus is transmitted, these are the controls, here's how you stay safe, totally apolitical. I feel better about that as the strategy rather than the, I feel like that's a path towards better compliance. It's an empowerment path. It says you make the decision, and also look, I don't think we can disentangle the personal risk profiles and personal risk tolerance. And so if you're in a region that hasn't been hit hard yet, I say yet intentionally, I understand. Well, why are we doing this? It's not here right now. And your risk tolerance might be different. Maybe some people who have underlying conditions would have a lower risk tolerance, and they should, and others don't. And everyone's making this kind of risk decision each day, and our values are different. Some people, well, I have to go get my hair cut. Okay, I get that. I'm not, if that's core to you, we have to go visit people. Maybe you haven't seen your parent in a while, and you're going to take that flight, and others think, well, how could you do that right now? Well, these are values that people have, and we're constantly making these decisions. And I just think for us, our job as scientists, say, here's what the science says. This is what we know how to reduce risk. And then all of these other decisions get wrapped up in it. The personal decisions, the politics, the economics. I'm not an economist. I'm not necessarily going to weigh in on that. And those are important. I'm not just saying public health should be deciding everything that's happening right now. So I think we deliver the science honestly and openly, and hopefully people make good decisions.
Okay, great. In colder climates, ventilation comes at a cost of increasing emissions from building heating. Since fossil fuel emissions also influence regional air quality, how do we find a balance that doesn't harm health?
Yeah, it's a great question, right? We can't disentangle, again, all of these other cofactors or issues. So in the short term, I'm on the side very much that the increased energy expenditures right now, as we get people back in buildings, is a good trade-off. The higher ventilation rates, we can't say, well, look, we're gonna close off that damper and keep the ventilation rate low, because that'll, our building's contribution to regional outdoor air pollution will increase and, have a wider population impact at the expense of the people in that building. I'd be really concerned about that approach. So we do have to think about it. I'm not saying we don't. I think as we start to get through this slow roll crisis, climate will be the slow roll crisis right in front of us. I think we just have to make smarter decisions holistically. But in the immediate term, I can't imagine advising anybody to say, spend a little bit less on your ventilation right now as people go back into indoor spaces. I don't think that's prudent.
Thanks, Joe. So there are several questions here about the UVGI system. So I'm going to try to walk through it. It looks like most of the questions have a component on your thoughts in regards to using localized UVGI and maybe high occupancy or high traffic areas of a building. That's one piece of the questions. And then in relation to that, with additional ventilation or filtration as a combined strategy.
Yeah, so I think there's a place for upper room UV. I do in high risk locations, high occupancy, high volumes places where you can get you can get many air changes of cleaning. It just is something that has to be done well. I would just caution that before making that recommendation, or if you do, to pair that with careful guidance, that this is not like changing a filter, right? It has to be done right. It has to be done well. You have exposure concerns for the installers, for the people in the room if it's not done well. If you're thinking about induct UV, there are other considerations also in terms of the efficacy. But I actually think there is a role, but you have to balance this against costs and time, what can be done when. But in larger, let's say in places where we're going to have large gatherings, I do think there's a role. Again, it's not any one solution works because we have multiple modes of transmission happening, but at least for airborne, I do think there could be a benefit. In terms of induct UV, I would again put it in that prioritization scheme of going for 100% outdoor air. You can't do that. Recirculate the air through high efficiency filters. If your system can't handle that pressure drop, then you need to think about alternatives in that case, right? And that is where these other air cleaning technologies could play a role, because obviously you don't have the pressure drop with something like UV. So I think there could be a role for it. I think it's highly specific and nuanced, and I'm hesitant to come out and make that more broadly as a recommendation, because again, my approach is we should be doing things that every building can do right now. Although I will say in the earlier pieces I wrote in early February and early March, I do mention UV as something that could be considered.
Great, thanks, Joe. Here's one for you. What do you think about colleges bringing students back to campus in the fall?
It's a great question. So I know Harvard just announced that we're going to do online classes into the fall. I think that was a good decision for many reasons, for Harvard anyway. And at least what I really like is they made the decision early so that people could plan. In particular, thinking about, we have a high international student base that seems unlikely to be resolved. People are trying to figure out their living conditions. So these are other factors that weigh into the decision on whether to open a university. But my feeling is, from an exposure and risk standpoint, can it be done? I'm confident it could be done. I think we can get people back on campuses safely. I think we can get kids back in schools safely. The bigger question is whether the control strategies we would put in, if the control strategies are stringent and applied and followed and verified. And then these other questions come into play, which can't really, we have to talk about, is whether pedagogically that works, financially does that work? Will certain people not just decide not to come back anyway? How would you handle students who have to travel? And then what's everyone's different risk tolerance and risk profile? And again, what's happening regionally? So if this country, I'm talking about US context now, got its act together and actually put in a wide-scale testing and tracing program and got its caseload under control, which it is not under control by any means, that would benefit us too. And it would be easier to get back and tamp down little pockets, or they would be little pockets of disease. We'd be able to detect it quickly and quarantine and isolate effectively. It seems like we're giving up on that regard, at least from what I see. It seems like we're just going to let cases happen through the summer. And so instead of starting with a low case load in September, we're going to start rip roaring in the US. That's a problem. So, I think from a pure building exposure risk science, could we develop control strategies to keep people safe in buildings? I'm 100% confident that could be done on campus. Whether or not all of these other factors are going to play well together or are going to align, that's a different question. And that's a question for really the leadership at universities. I think it's our job to help inform them to say, if you want to go back, this is what you're going to need to do.
So I'd like to ask you a follow-up on that. I play in a music group in my free time, and there's actually been no discussion of how orchestras and bands and other ensembles are going to function moving forward. Do you have any advice for music ensembles when there's a lot of air moving around and there's oftentimes a couple hundred people in an ensemble in a confined space?
Switch to a string instrument. I'm kidding. No, but I think this was a little bit of what I was getting to. Does it work pedagogically? Does it work? Is that the kind of education experience we want if we have to curtail these other things which we know are really important, including choir practice? I don't see how we can go back to choir practice. Wind instruments, I think, is really challenging. maybe outdoors with some spacing, okay. But I think if we were to go back to universities or even getting kids back in K through 12 schools, it's going to have to look a lot different, and we're going to have to curtail many of these activities that are higher risk. You know, and so it's not like I'm saying, or I don't think anybody else is, that, hey, we come back in September or late August and it's just like it was last year. There's no way it can be like that. So yeah, it'll have to be different. And whether that, I think that's part of that decision matrix. Is it too different that where it's not worth it, where we can't do things like this?
So there's a question here on can you share any international examples where they have successfully created healthy buildings that we might be able to adapt here in the US?
Yeah, I'm hesitant to name specific buildings or companies, but there are a lot of examples internationally of companies and organizations and architects and designers that are really taking these healthy building principles and putting them into practice. I've talked with and worked with companies in Hong Kong, in South Korea, in Europe. I'm on a panel I've become friends with Norman Foster, you know, in my opinion, the top architect in the world. And he's been talking about breathable buildings and healthy buildings since the 60s. So he's a pioneer in this space, right? He's converted, and a lot of his buildings are already doing this, and that's what they're aspiring to. We have a new, what might be interesting for this audience is we have a new Harvard Business School case study that just got published last week. And it's about healthy buildings, and it's about the economics of healthy buildings. And we used 425 Park Avenue in New York City. So not international, it's a US context, but there are lessons for everybody, where we walk through the healthy building decisions they made and chose. It's a Lord Norman Foster designed building, beautiful building in Midtown Manhattan. And then we walk through the pro forma, the financial spreadsheet, to look at the financial impacts of the business against the costs of implementing these healthy building strategies. So it's very much designed to engage the business community into this healthy building discussion. And now I wrote that with the co-author of the book, John Macomber, at the business school. And our interest isn't necessarily the shiny new building in Midtown Manhattan, which of course has a monster budget and they can do lots of things that other buildings can't. Our interest was using that as a way to advance this conversation and work with students to figure out, well, what healthy building decisions can propagate through the market that these leading players can do, they might have the budget for, but what can everybody do? And what strategies can come out of this? And by the way, we hope one of the key takeaways is that the finances work for every building of every size. And so this is what we do in the classroom. I lecture at the business school, and in his class, he lectures on business in my healthy buildings class at the School of Public Health. So we can cross-pollinate these two worlds a little bit, get the public health side thinking about the business ramifications of their recommendations, and the business school students to think about the health ramifications of their decisions.
Great, thanks. All right, we have a question here on VOCs. It's referencing back to one of your slides and asking what kinds of VOCs were measured. Is there evidence that the VOCs can affect cognitive functioning or increase susceptibility to the virus? And are there any VOCs that would then be of more concern than others?
So I haven't seen anything on increased susceptibility related to VOCs, other than I guess more broadly, we know that some VOCs can impact respiratory function. But that's not to say that I know something specific or I haven't seen any publication. If someone's seen that, please send it my way. I haven't seen that. I do think it's part of overall a healthy building strategy. It's also tied into ventilation. But first, we want to think about source control. How do we reduce the VOC emissions in the products we choose? And maybe it's a good time to plug and say it's not just VOCs. We have to be thinking about the semi-volatiles, the SVOCs. In particular, those that cause not just acute effects, but those that interfere with our bodies in more subtle and chronic ways. Our carcinogens, some interfere with our hormones, endogenous hormone system. So I think we have to be thinking about all of this. And I actually think this materials conversation, maybe not in our field, but it's flying very few are talking about it in the building space, the commercial side of this, right? The science community is talking about it, has been for a long time. But we need to do a better job there because, you know, as we have everyone's ear on healthy buildings and they're asking what else beyond ventilation and air quality related to the virus, it's our time to talk about all these other factors, including these chemicals in building materials and the choices we're making.
Great, thank you. And here's the last question. Are there ventilation standards for varying indoor particle loads?
I'm not sure I fully get what that's saying, but you know, there's a couple things that's going to drive particle loads. A lot of things are going to drive particle loads inside of a building. Outdoor air pollutants that penetrate indoors, indoor sources. If you're in a home cooking, activities of folding laundry and vacuuming will generate airborne particles. In the context of COVID-19, people, well, we generate aerosols all the time, but infectious aerosols if someone is sick and shedding a viral load. So, but these standard, the recommendations we're talking about, and even what ASHRAE is talking about, are designed to provide air quality that can minimize risk from airborne transmission, both on the filtration side, but also just on the straight dilution side.
Okay, great. Well, thank you. Thank you, Joe, for a very informative presentation and for answering all of those questions. Thank you very much. Thank you to all our participants for participating in this month's webinar. Within the next day or so, you will receive an email from the Society that includes a link to evaluate the presentation and provide some feedback. And please share your ideas on other topics you would like to see for future webinars. We're always recruiting for speakers. As a last reminder, the recording of today's webinar, along with all the PowerPoint slides, will be provided and posted behind the members only shield on the ISCS website. So if you are not a member, please consider joining to be able to access the slides. And a last reminder, the abstract submission system for the 2020 meeting has been extended until June 30th. And that should be up on the website as of today. All right, and with that, I thank you very much.
Thank you.